Our Megan Batchelor has been following these latest updates, and she joins us now. So Megan, take us through what the Ontario health officials are saying today.
Well, Andrew, it was interesting hearing that press conference. So we're learning more about this latest case. This is now the third case in Ontario, fourth case in Canada. And it really shows just how fluid this situation is. The officials there talked about how the improvement in testing caught this latest case because she had arrived back from China on the 23rd of January, went to the hospital on the 24th when she started showing symptoms. She was released after testing because she did not show any sign of coronavirus. They went back a few days later after that testing has been evolving, went back, they've been testing it, and now it has come back as positive. But it is very low grade. This woman has been in home isolation ever since she got back from China. She is in her 20s. We also got a statement from Western University where she attends. They say that she has not been on campus since returning home to London, Ontario on January 23rd. So this now adds a fourth case in Canada. It's worth emphasizing here that all four cases now in our country, nobody is in hospital getting treatment. They are obviously in touch with health officials in case of infection or anything like that. But nobody is getting care in a hospital. In fact, we know of the first case that was confirmed in Canada. He today was released from hospital. So with this latest case, the testing really evolved in allowing officials to make this declaration. And here's what they had to say about that process.
So that during that time, with cross-referencing with even more specific and more different testing, different type and more specific one of the National Medical Microbiology Laboratory, they contacted our lab and said one of their tests came back as positive, weakly positive, and they had discussion on that basis there. And as med microbiologists do, they'll say, well, I think in this case, on a precautionary basis, we should switch this one from a negative to a positive, even though the level is very low. And the sense is that the viral load was very low as well. Nevertheless, to be thorough and precautionary, this one should be switched to a positive case.
And again, in this case, as we've been hearing with the three others in our country, officials saying that the patient really took things upon herself, did everything properly. In fact, she was wearing a surgical mask on that flight to London, Ontario from China. Even though she wasn't symptomatic at that point, she took herself to hospital. She has been in home isolation ever since. And we're also hearing from officials that she has now fully recovered. And that, of course, also is worth mentioning. So now we do know that there are 4 cases in Canada, 3 of them in Ontario.
All right, Megan, thank you.
You're welcome.
So let's talk about this development with Dr. Michael Gardam. He is the Chief of Staff at Humber River Hospital and is in Toronto. So Dr. Gardam, a third case identified in Ontario. Officials say the system worked well. What are your thoughts?
I would agree. This third case, all of these cases are pretty much expected. We know that the area around Toronto and Vancouver are the 2 places where people coming back from China are most likely to end up. So this is again showing that the system that public health has set up at the airports and with public messaging is actually working.
So there have been some questions about asymptomatic transmission. So tell me what your thoughts are on that and what we learned from that news conference.
I really wish we could put that concept to bed here. We know from all the other respiratory viruses that we've studied that before the onset of symptoms, for a period of maybe 12 hours, 24 hours, people might shed low amounts of virus before they get ill. But then once they develop symptoms, typically you're looking at them shedding 10,000-fold more virus for a period of several days, and they're having symptoms where they're actually spreading it. So, you know, the concept of this outbreak being fueled by people walking around with no symptoms whatsoever and spreading it really does not make biologic sense. And I think we really need to change the conversation to we're trying to pick up people who have symptoms, because those are the ones who are actually fueling the spread of this.
What do you make of the fact that she first tested negative and then there were more sensitive tests and it came back positive?
Yeah, we see that all the time with viral testing, that people who have very low viral loads may be negative, and that's one of the reasons why the original tests done at the provincial health lab are then sent off to the national lab in Winnipeg. So this person was obviously right on the cusp of the level of detection for this test. And so that again tells me that, this person, I really can't worry about them being contagious. And to me, that's really the most important thing here. The other thing that's interesting, right, is that as we see more and more cases outside of China, those cases are very instructive because we have lots of time to really investigate those cases well. And by and large, most of these people have cold-like symptoms. They do not have the serious disease, which is the tip of the iceberg that we're hearing about in China.
How would you assess the level of risk today, say, compared to this time last week in Canada?
Yeah, level of risk in Canada currently is essentially negligible. We are picking up cases, the rare cases as they come to Canada, and people worry, well, what about the cases that we may not be picking up because they have such mild symptoms? Well, clearly those individuals are not transmitting anywhere outside of China because we would hear about it, right? We would hear about cases where people came forward and had the coronavirus but didn't have links to China. The fact that all the cases we're picking up and imported cases, and it's only occurring in their very close contacts. So this, again, I think reinforces, every day that goes by, it reinforces in my mind that this is fairly hard to spread. A lot of the people who are getting it have very mild symptoms, and we're not seeing transmission where it's been imported.
I know that, of course, your concern is people who live here, but as a medical professional and you're watching and observing what's happening in China, how would you describe the outbreak for them?
I mean, obviously in China, what's happened, and this happens with most outbreaks, is that you get a few generations of transmission before you realize you have an outbreak. We never identify an outbreak with one case. Typically, it's usually after things have moved on for a while. So now they're playing catch up, and they're playing catch up at a time when it's still a fairly significant influenza season at the same time. So there's a lot of noise in the background as people are coming forward with symptoms. So my heart goes out to the healthcare workers who are trying to control this in China. I really think, the country truly is pulling out all the stops trying to control this. What they've done with locking down, tens of millions of people is really unprecedented. And I think, to me, speaks to the fact that they're trying very hard to get this under control.
All right, so for people watching, we in the media have these discussions all the time about how much coverage there should be, whether it's too much, whether it's too little, but, we're doing it right now. What would you say to people, just some advice about, what they should do if they're worried?
Yeah, it's very hard to walk the fine line, right? Because we don't want to blow this off. We want to take it seriously, but at the same time, currently, there really is no risk to Canadians. The concern is that if this gets away on us, there could be a risk to Canadians. And it's often very hard to kind of walk that line. So my message to people right now is this is not something that your average person walking down the street should be worried about. I wouldn't be wearing a mask. I wouldn't recommend masks. But this is something that Canada and the health system needs to continue to take very seriously to make sure that it does not become a threat to Canadians.
Dr. Gardam, always appreciate you taking the time. Thank you.
Thanks for having me.
Dr. Michael Gardam in Toronto. He is the Chief of Staff at Humber River Hospital.